Always follow the directions on the product package. If you have any questions, ask your doctor or pharmacist. Do not use a solution that has changed color or is cloudy. Some eye drops need to be shaken before use, so check the label to see if you should shake your product before using. Systane drops may be used as often as needed. Ointments are usually used 1 to 2 times daily as needed, and if using an ointment once a day, it may be best to use it at bedtime. To apply eye ointment/drops/gels, wash hands first and be careful not to touch the dropper or top of the ointment tube or let it touch your eye. Always replace the cap tightly after each use. Tilt your head back, look up, and pull down the lower eyelid to make a pouch. For drops/gels, place the dropper directly over the eye and squeeze out 1 or 2 drops as needed. Look down and gently close your eye for 1 or 2 minutes. For an ointment, hold the tube directly over the eye and gently squeeze a small strip of ointment into the pouch. Blot away any extra ointment from around the eye with a clean tissue. If you are also using another kind of eye medication, wait at least 5 minutes before applying other medications. Use eye drops before eye ointments to allow the eye drops to enter the eye. If you wear contact lenses, remove them before using most kinds of eye lubricants. Ask your doctor or pharmacist when you may replace your contact lenses. Check the package to see if you can wear your contact lenses while using your product. Tell your doctor if your condition lasts or gets worse after 3 days. When you first use Systane drops, you may experience temporary blurred vision and minor burning, stinging, or irritation. If these effects persist or worsen, it's important to contact your doctor or pharmacist right away. If your doctor has prescribed Systane drops for you, it means they believe the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to seek immediate medical attention if you experience any serious side effects, such as eye pain, changes in vision, or continued redness and irritation of the eye. While rare, a serious allergic reaction to Systane drops may occur. If you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. Remember that this is not a complete list of possible side effects, so if you notice any other effects, it's essential to contact your doctor or pharmacist. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Systane drops, it's important to talk to your doctor or pharmacist if you have any allergies. These drops may contain inactive ingredients that could cause allergic reactions. If you have any health issues, make sure to consult with your doctor or pharmacist before using this product. After applying Systane drops, you may experience temporary blurred vision. It's important not to drive, use machinery, or do any activities that require clear vision until it is safe to do so. As for the best time to take this, it is recommended to use the drops as directed by your doctor or pharmacist. When using Systane drops, it is important to be aware of potential drug interactions. These interactions could affect how Systane drops work or increase the risk of serious side effects. It is important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It is crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. It is important to consult with your healthcare provider before making any changes to your medication regimen. If you or someone else accidentally swallows Systane drops, it could be harmful. If the person who swallowed the drops is having serious symptoms like passing out or difficulty breathing, it's important to call 911 right away. Otherwise, contact a poison control center immediately. In the US, you can reach your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. It's important to keep this medication out of reach of children to prevent accidental ingestion. If you wear contact lenses, it's important to be aware that some Systane drops products contain preservatives that could potentially damage your lenses or cause irritation, especially if you have allergies. It's best to check the product package for more information or speak with your healthcare professional if you have any concerns. Systane drops are typically used on an as-needed basis. It is used to relieve dry, irritated eyes and to provide temporary relief from burning and discomfort caused by dry eyes. You can use this medication as often as needed to keep your eyes comfortable and moist. It is best to follow the dosage instructions provided by your healthcare professional and use the drops at the optimal time to get the most benefit. When using Systane drops, it's important to follow the storage instructions on the package. Make sure to protect the drops from freezing and discard any preservative-free drops in single-use vials or droppers either immediately after use or within 12 hours of opening. Check the product package for specific disposal instructions. If you have any questions about storage, it's best to ask your pharmacist. Remember to keep all medications out of reach of children and pets. And when it comes to disposing of Systane drops, do not flush them down the toilet or pour them into a drain unless specifically instructed. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.